Hi everyone, time for another video. Now we are talking about the molecule label leading to phenylketonuria. So in this topic, we are especially talking about phenylketonuria. So what is it? It's an autosomal recessive genetic disorder caused by dysfunction of PAH enzyme, and this results in accumulation of phenylalanine. I will show it to you. So that's phenylalanine enzyme, and when the enzyme is not working, the production of tyrosine is stopped. So when the production of tyrosine is stopped, then there will be a lot of phenylalanine in the body, which would be toxic. And it's an autosomal recessive genetic disorder. So how does it happen? Mutation in any domain of protein leads to failure in the catalytic binding site. So we have talked about this before. Mutation in any of this protein domain ultimately leads to failure of the catalytic binding site. If the catalytic binding site is not functional, then the substrate cannot bind to the active site of the enzyme, and hence enzyme becomes dysfunctional. So what happens in phenylketonuria is that the substrate is phenylalanine. Phenylalanine fails to bind to the active site of PAH enzyme, and hence there will be overproduction of phenylalanine. Now talking about forms of PKU, so the most common form is classic phenylketonuria, and the milder form, the most safe form is hyperphenylalaninemia. The word hyper means more or excess. Phenylalanine means the amount of phenylalanine. So it's also known as too much phenylalanine in the body. Severity of this disease varies from person to person. So these are the symptoms: mental retardation, mental damage, intellectual disability, psychiatric disorder, behavioral problems, skin flare-ups, eczema, smelly breath. And talking about prevention and treatment, avoid any high protein foods because all of them contain phenylalanine in their diet. Take protein supplements that doesn't contain phenylalanine so that the person gets enough protein supply despite restricting the diet. And the other treatment is oral supplementation of tetrahydrobiopterin. So going on the oral supplementation, supplementation of tetrahydrobiopterin may improve blood phenylalanine control and allow some relaxation of the dietary phenylalanine restriction in responsive individuals with PKU. So in Australia, saproprotein is given to people who suffer from hyperphenylalanemia. So saproprotein, it's a kind of sapropterin is kind of synthetic form of BH4, and it is given to people suffering from phenylalanine excess phenylalanine, which is also known as hyperphenylalanemia or phenylketonuria. So it's given to those people and it's used as a treatment. But however, this treatment had limitations because sometimes BH4 doesn't work for some people. Therefore, future treatments needs to be made. For the future treatments, we have gene therapy and enzyme therapy. So gene therapy is when uh, the mutated PAH gene is replaced with normal PAH gene. So how does this occur? This may happen when there will be advancement of gene technologies in the future, And using plasmid DNA or complementary DNA, uh, plasmid DNA containing PHED gene, plasmid containing PHED gene can be directly injected into the liver, and hence this disease will be prevented. Enzyme therapy is the other use, other treatment, future treatment opportunity. They have already tested in mice. So what they do is they inject phenylalanine, normal phenylalanine hydroxylase enzyme, or pH based fusion based proteins into the liver. So they inject phenylalanine hydroxylase into the liver, and then it starts working to convert it to convert phenylalanine into tyrosine. So phenylalanine gets reduced, converted to tyrosine. Phenylalanine gets converted to tyrosine, and it will reduce phenylalanine in the body, which will treat the disease. So this is talking about those two, and that's how it's treated. Thank you.